Thinking about insurance, one thing is pretty universally true, primarily that all insurances work the same, but they also sorta, kinda, mostly really don't. But this is especially true for those folks who are used to having work insurance and then are moving into Medicare. So let's talk about the 5 biggest differences between work insurance and Medicare. Now this is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it does really help our channel to grow, but also because it'll keep you up to date about the newest Medicare changes, the newest Medicare options, and ways to make more, better informed Medicare decisions. All right, here we go. One of the most common ways for people under the age of 65 to get health coverage in the United States, for a variety of reasons, and we won't get into those in this video, but most people get their coverage through an employer or even perhaps through a union. And these plans can range from just okay, as far as being how good they are, to really good to amazing, just depending on the employer that somebody has. There are usually many options with different carriers, different costs, and different coverages that are available through one's employer. But once somebody stops working or retires, there is a whole different situation, a whole different insurance world than what they were used to when they had their insurance through their employer. That is, of course, Medicare. So let's talk about the 5 biggest differences to look out between Medicare and work insurance. One of the first and biggest differences between work insurance and Medicare in the United States is how to actually qualify for the health coverage. Because to qualify for work coverage, usually it's pretty simple, or at least it sounds pretty simple, just because all you have to do is gain employment with a company that provides their employees with work insurance coverage, usually after a certain amount of probationary period. These probationary periods can really vary depending on where somebody works, but they usually have a probationary period. Once that is done, then you can sign up for a plan, whichever one you like, and away you go. For Medicare, it is a bit more complicated, because to be eligible for Medicare, you have to have lived in the United States for 5 years consecutively. You also have to be a U.S. citizen or a resident, and furthermore, a person needs to be at least 65 years old, or can possibly be under 65 years old, but have other qualifying eligibility, like being disabled for 24 months or 2 years, or having specific illnesses like ESRD or ALS. So yeah, at work, I mean, there aren't really any age requirements. There isn't really any requirements other than that probationary period, and there isn't any citizenship requirements. So those are the first kind of biggest differences between work insurance and Medicare. Next up, and yet another big difference between somebody's work insurance and their Medicare insurance, is how the benefits and plans are structured. Now, when somebody gets work insurance, it is usually a pretty typical format of health insurance coverage for under 65-year-old plans. There are deductibles, there are co-pays, there are co-insurances, and there's an out-of-pocket maximum. And these costs are for things like hospital care and doctor's visits, medications, and the like, but they are all under one single kind of company and all add up to one single out-of-pocket maximum yearly that somebody would have to pay. Medicare, on the other hand, is not so concise, because Medicare is divided up into multiple sections that cover specific types of healthcare issues individually. For example, there is Medicare Part A that covers hospitalization. This would be for things like spending a night in the hospital, or big surgeries, or skilled nursing care, and things like that. Then there's Medicare Part B, which covers more of the day-to-day care. That would be like doctor's visits and lab works and x-rays and specialty physical therapy. All those kinds of things are bundled under Medicare Part B. So those are the first 2 parts of Medicare, or what is called original Medicare. It is possible to have just one of these, so Part A or Part B or both. Furthermore, there is Medicare Part D, or Medicare prescription drug coverage. That is a separate part of plans from the A or the Part B. Part D covers Medicare prescription drugs that are prescribed by a doctor and picked up at the pharmacy. And the reason for this primarily is because original Medicare, well, it doesn't have any sort of drug coverage put onto it, so that Medicare Part D plan is an additional plan at an additional cost. Lastly, there are Part C, Medicare Advantage plans, Medigap plans, Medicare supplement plans that help pay for those healthcare costs that are not covered by original Medicare. So when we break it down, the employer coverage is one single plan and one single coverage that covers hospital care, doctor's visits, and drugs, versus Medicare that has 4 parts: Medicare Part A, Part B, Part C, Part D, and then you may even potentially have a Medigap or a MedSup on top of all that, basically to do the exact same thing. You gotta love healthcare bureaucracy, right? Yeah, anymore, right? So next up for differences between work insurance and Medicare is going to be the cost, because the costs are set up under Medicare, way different from one's healthcare cost under their employer coverage. For cost, first let's talk about monthly premiums or monthly costs, because under the employer, generally in the United States in 2024, the cost for healthcare plans is split with the employer and the employee. In fact, employers with over 50 employees, it is mostly mandatory, of course with some exceptions, to pay for at least 50% of the cost of their employees' health insurance costs. That means that the cost for health insurance for employees usually is just half the true real total cost. So there is one cost that gets split and paid to whichever insurance company plan that an employee chooses for themselves, and is paid half by the employer and half by the employee. Easy peasy, lemon squeezy, right? But for Medicare, there can be various and disparate payments for up to 4 different parts. For example, there is a Medicare Part A, which may or may not have a cost to it, Medicare Part B, which almost always has a cost to it, and someone can have either or both of those, and then have a Medicare Part D, which is a separate plan and a separate cost, as well as a Medicare Supplement plan, which is a separate plan and a separate cost. So you essentially would have to pay Medicare, Medigap, Medicare Part D, or even maybe a Medicare Advantage plan, depending on what you get. So needless to say, there are lots of payors, people that get paid when you're on just Medicare. Now that is just for the monthly premium cost. When it comes to actually using the healthcare, if someone has original Medicare, many of those costs under one's work plan that were simply a copay, a set dollar cost like a doctor's visits, becomes actually a co-insurance, where instead of paying like a $5 copay on a work plan, Medicare Part B will cover roughly 80% of those costs, leaving 20% left over for the Medicare beneficiary. Another big sticking point is when it comes to healthcare costs and work insurance plans, there usually is an all-encompassing out-of-pocket maximum for one single year, and it could be $2,500, it could be $9,000, it could be $12,000, whatever the total summation is. That is the total amount that a person can pay for all their doctor's visits, for all their medications, and for all their healthcare costs in the year on their work plan. Medicare, on the other hand, it doesn't have a cap, which means that in unlucky situations, the costs for care can far exceed that of a private employer plan for the out-of-pocket maximum. All right, so let's move away from cost, because that can get convoluted and messy, and move into something that is actually a lot simpler on Medicare versus on somebody's work insurance. Well, sort of, which is doctors' network. Now, doctors' networks get a bit tricky depending on the Medicare path that one takes, but in generally, especially under original Medicare, doctors' networks are pretty easy. And in fact, in many cases, they are better than work insurance networks because there aren't any doctors' networks. This means that as long as the doctor somebody sees is willing and able to bill Medicare for their services, then the Medicare beneficiary can go see them. Additionally, because there isn't any networks, they have pretty much free reign to send you to a specialist or other doctors without having to get pre-approvals or limited numbers of visits, or even possibly being denied, like it is possible on a health plan through somebody's work. There are not any HMOs or PPO type networks, there is just Medicare, which in principle is good, except for one little tiny thing, which is that work plans tend to pay doctors more for their services than Medicare, like a sizable amount more. So some doctors may decide not to take a Medicare patient or limit how many Medicare patients they take because they have private work plans that are going to pay them more for that same amount of time for that same visit. It's kind of the way economics work. This means that the nice thing about Medicare is you don't have to deal with all the insurance company bureaucratic work of pre-approvals, doctors' networks, and insurance companies, and not letting someone go to a doctor they want to see. But the doctors themselves, they may not take the coverage. But most doctors in the United States will. Still, pretty big difference. Our last up for today, and there are still many differences. But the last big difference for someone on Medicare versus someone's work insurance is when someone can change their plans. On work coverage, there's generally an initial time that somebody becomes eligible for work coverage, and then every year after that, the person can change their plan during the open enrollment period. This open enrollment period can really be set at any time during the year, but mostly it's just whenever the month that the company wants to set it at. Medicare, on the other hand, is more and less restrictive about changing enrollment options. For original Medicare, there is the initial enrollment period when somebody becomes initially able to enroll into Medicare, usually at 65 years old, but it can be younger for specific reasons. Then, throughout the year, changes cannot be made until the following annual election period would happen during October 15th through December 7th every single year. Outside of that time, though, somebody can qualify for special enrollment periods that will allow them to enroll or change their Medicare plans. For example, if they are getting assistance from a Medicaid or Medi-Cal, as they call it here in California, for low-income individuals, or they have extra help from the low-income subsidy program, or have another qualifying event, like they moved or they were affected by a natural disaster. But without any of these SEPs, they won't be able to change again until the following AEP period in the next October. All right, so that is the 5 biggest differences between somebody's work insurance and Medicare. And if you're in a situation where you are up against the wall to get into Medicare and you have a lot of questions about your Medicare, or you need some help looking at which plans might be the one that fits you best, please feel free to contact us at the information down below, or leave a comment, or even just check out our other great Medicare content on Instagram and YouTube. And don't forget to follow and like and subscribe. So for My Goals Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.